Bom dia a todos. Quero agradecer a presença nesse webinar, que faz parte da nossa programação de 20 anos de imagem corporativa. Nós temos hoje, para iniciar esta manhã de conversas, nós temos o Gil Bashe, que é um profissional de classe mundial e com uma longa experiência na área de saúde. O Gil Bashe, ele é Global Chair Health na Fin Partners, que é uma empresa de PR baseada com sede em Nova York, uma excelente PR company, com escritórios em 14 cidades dos Estados Unidos e também no Reino Unido, França, escritórios em Reino Unido, França, Alemanha, Israel, Singapura e China. O Gil Bashe é também Global Chair do Healthcare Sector Group na PROI, que é a nossa PROI Worldwide, que é a nossa rede global de agências de PR, com presença em 55 países. Agora eu mudo para o inglês. So, Gil, we are very glad to have you here. I was saying that you are
I understood, but you left zero. You left something out very important. You touched on all the titles, which is very kind of you. But the greatest title I have in sharing comment with you and your colleagues today is as one of your admirers and a friend. I hold you in the highest regard, and I think my professional titles are tertiary to the fact that I'm connected to you, I admire you, and I'm here today with you and Sharon, your community, your agency community, your clients, your industry friends, to recognize you and your organization on this incredible 20th anniversary milestone. That to me is the best title or background you could have shared. So my understanding was a little more than you thought, but I have to say that you left out the most important part. This is a salute to you and your organization.
Thank you, Gil. Very kind words. And the good thing is that chatting with you is always a great opportunity to learn something interesting. You are the type of leadership that connects. You connect the dots and always offer surgical overviews about the health landscape. And I think that there's nothing more logical than starting this conversation by asking you to share your views about the COVID-19 and the vaccination programs and the learnings and takeaways from this already 18 months of pandemic, and keeping people posted that you can address questions to Gil on the chat, and I will be more than glad to share your questions with him. So, Gil, it's on you now.
Sure. Thank you so much for that introduction, and thank you so much for including me. I know that a lot of energy has gone into this global conversation, and I just want to give a caveat before I kick off that I think you and your guests might appreciate that I'm sitting obviously with a green screen behind me right now, but I'm actually isolated in my daughter's room. I'm with COVID, recently diagnosed. I was in the hospital on Sunday. I will talk a little bit about that experience, since as a public health person who knows health, has a health background, I appreciate the topic we're going to talk about it. But, you know, I often believe that we're talking about things that are theoretical, and that we don't have the advantage sometimes of talking about these things from the point of view of firsthand experience. Some of you I know have had COVID. Sharon, your co-host at today's conference, told me she and her husband and 2 children actually have recovered from COVID. She has 2 small ones. Obviously, children often catch COVID. They're asymptomatic. Parents don't realize it. They pass, along with their hugs and kisses, they pass their viral germs onto their parents, and people get ill. COVID is insidious. COVID is part of our conversation. And much like everything we do, it's sort of what TV are you going to watch, and what do you think about COVID? What do you think of the soccer game and COVID? COVID is part of every single conversation. And the reality becomes now, as communicators and business leaders, what do we do about our businesses as communicators, and how do we take care of people? So I want to talk a little bit about COVID, but to get into that, I also want to say I'm vaccinated. I do travel. I have global responsibilities, as Ciro mentioned. I am generally masked or double masked when I fly, and I travel with sanitizer. I do wash my hands. I do watch my distance, and I got COVID. So let's keep this in mind, that probably the only way to consciously avoid COVID is either good fortune. There is such a thing as good fortune. I don't want to say luck, but good fortune, and staying in your homes. Staying in your homes is a good reason to avoid COVID, but that's not possible for everybody. It's not possible for our frontline folks who work in stores, who serve food, who are in fire departments, police departments, who are operating businesses where their household sustenance is dependent upon showing up. Even with masking, they're at risk. So I want to switch to a topic that's related to COVID, and we don't talk about enough, which is trust. People are interested in COVID, and I can talk about the science of COVID. I can talk about vaccination. I can talk about policies. I can talk about safety rates. I can talk about cost. But because this is the 20th anniversary of really one of the globe's great communications firms, I want to talk about something that I think is near and dear to all our hearts, which is establishing trust. And I think one of the biggest challenges we've had from a public policy standpoint and from a corporate policy standpoint in establishing a rhythm with COVID is the inability to get comfortable with these few words. And you may want to write them down, because these words will actually guide you in determining smart COVID policy. And I'm not being facetious. I don't know. I don't know. We only know what we know as we know it. And the problem with COVID specifically, in terms of a global policy, is we often know what we know at a given moment. So for instance, if I trace back when Ciro and I were first talking about these topics some 18 months ago, initially, the head of one of the heads of CDC, infectious disease, Dr. Anthony Fauci, said publicly, don't mask. And then he said, do mask. Then he said, wash hands, don't wash hands. Distance, don't distance. And so people take that as lack of truth, when actually what's happening is we forget science. And that's what we're dealing with, public health. We're dealing with science. Science is an evolutionary process. So I want to stop and give you a personal story. I mentioned that I was in the hospital on Sunday. I was traveling in Eastern Europe. I took a internet supervised antigen test, where they use a Q code and watch me taking the test. That test was negative, COVID negative. I arrived at the airport in Kiev. I took a bona fide PCR test. I boarded my flight for Vienna. I received the results from the PCR test. It was negative. I arrived in the United States. The next morning, I took a home antigen test that has about an 85% accuracy rate. It was negative. By that afternoon, I was feeling some symptoms. I took a home antigen test again. It was positive. I took the test again the next morning, positive. Does that mean I was negative the whole time? No. It means, according to the science at hand as we have it, my viral load was developing and went from negative to positive. It does not mean that the negative was a false negative. It means that the specificity of the test could only give me a negative at that moment until it was definitively positive. So the problem with corporate policies or public policy is like my test. It's like my antigen test. It knows our governments, our public health officials, our doctors, you, corporate leaders, communicators, only know what you know. And so what we have to do is sit back now and reflect on what we're saying, which is based upon information at hand at a given moment. Having been also in private equity myself, I remember being close to signing deals with companies we were about to acquire. I'd get a call from the chair of the managing partner of the private equity group, and he would say, I want to change the contract. And I said, we're having the celebratory dinner. We're signing next morning. He says, that's okay. Shifting sands. That's an economic term. Shifting sands means the data have changed. My thinking has changed. In business, we're used to shifting sands, but for some reason, when it comes to science, we see science almost like 1 + 1 = 2. It was 2 yesterday. It's got to be 2 today. No, science doesn't work that way. It's an evolutionary model. So one, you're asked to make decisions based upon public health science. And I know Ciro has worked with many of you in developing corporate communications policies regarding COVID. And he and his team are expert at that. They're expert at that. They're expert at that because they are looking at communications as an evolving model. Corporate leaders often look at things as this is what is the fact. This is what we're going to do. And they don't realize what you're going to do might have to evolve, not change, evolve. It's evolving based upon new insight. So one, the reason I share that I don't know comment with you is, as leaders, we're very uncomfortable saying, when asked a question by reporters or by investors or employees, I don't know. Now, I don't suggest you run out to the streets and say, as a CEO, I don't know. It doesn't sound very confidence building. But I do say that you can say, based on the information at hand now, this is the best course of action. And that may need to change as more information becomes available to us later on. So I just want to start our conversation off on thinking about, as I said earlier, trust. Trust is about establishing authenticity. And it's also about thinking about what the listener is getting from your conversation. That's very important. So now Ciro had asked me to speak about a number of topics. I do want to address them in the context of that backdrop. He asked me to speak about vaccination. He asked me to speak about the context of corporate policies. He asked me to speak about the challenges of the crisis on the future of health and corporate health. And he asked me to sort of speak about our commitment to employees in light of COVID. COVID is a virus, but it is also a cultural game changer. Make no mistake about it. How many of you have been working in a virtual setting? How many of you are attending this gathering today, not in the offices of your agency, a great agency, but by your laptop computer, your desktop computer? Probably all of you. And when we look about this, we have entered the permanent world of remote. And I would say probably hybrid, but hybrid leaning more toward virtual than physical, And that means, going back to what I started off with, trust. Trust is the central theme of COVID, because for you to have a vibrant, strong, hybrid, mostly virtual business community, you must build as leaders, as communicators, as corporate leaders, and certainly as corporate leaders, you are communicators. You must focus your centrality, your energy, your commitment on building trust with your community around all issues, because they're no longer within eyesight, but they must be within thought. So COVID is almost unescapable unless you lock yourself in your daughter's bedroom, as I have. By the way, this is a virtual background. It's a lovely virtual background celebrating the 20th anniversary. But behind me, even though my daughter's now 27, is a collection of stuffed panda bears and small little cats. I don't understand why a 27-year-old still needs panda bears and stuffed cats, but apparently that's still appropriate decor. Although she doesn't live with us any longer, she has her own place. We're left with the stuffed animals, I guess, as she goes off to lead her adult life. But I would say that short of locking yourself in your rooms, and you're not going to do that, you need to create safe work environments. And you need to understand that you can't prevent COVID because you don't know what your employees, your colleagues are doing when they're not going to and from the office. Are they going to the coffee shop masked? Are they sanitizing their hands? Are they maintaining social distances? Are they going out clubbing? You don't control any of that. You don't control their lifestyle. Remember that. What you do is create a safe environment for all, always, whether it's COVID, whether it's workplace harassment, regardless, your responsibility is to rise above COVID and say, you know what? We've always been responsible for creating a safe, healthy work environment. That also includes COVID. It also includes gender inclusion. It includes also racial inclusion. It includes us addressing different disparity issues, safe and healthy workplace, including COVID. Now, regarding COVID policies, I'm approached constantly about that and how many people should come to an office. Should you be masked or not masked? You should follow the safety protocol of your countries. Each country has a different safety protocol. Sweden and Germany have been different than the United States. The United States, we've seen now, is no longer a model for the world to study in public health. That's my COVID cough, by the way. The United States actually is not one nation. That's a misnomer. So for those of you who look to the US for a model, I wouldn't. I would look to countries like Germany or France or Israel or Singapore as better public health models. They're monolithic. They use digital health tools more effectively. They have better testing protocols. The United States has some states that mandate masks, some states that don't. Some states that encourage vaccination, some states that don't. Some states that offer monoclonal antibody therapy for those people early diagnosed, some states who don't. We have essentially in the United States 51 different health systems. Each state has a commissioner of health. And then on top of that, there's the federal system. The federal system can offer guidance. The state system and its governor, who's like a president of that state, can either accept that or not, as we see in Florida and Texas and Louisiana, which have some of the highest mortality rates due to COVID. What's the cost of this for the United States alone for non-vaccination? Well, I can tell you that the preventable COVID-19 hospitalization among unvaccinated adults has topped $5 billion in 3 months. $5 billion in 3 months. Let me repeat that. Preventable COVID-19 hospitalization among unvaccinated US citizens topped $5 billion in the past 3 months. Where does that come from, that $5 billion? It doesn't come from the consumer largely. COVID is covered under state and federal policies. It means that in this country, we are effectively draining resources that could go to feed the hungry, educate people, build schools, improve roads, and so forth. So we're dealing in this nation with a very, very fragmented system. So regarding vaccination, I would say that in some states and some employers, you can mandate in this nation vaccination. And what you can do is say, I can't tell you to get vaccinated. I can't mandate that. But as an employer, I can say, if you want to come into this workplace, you need to be vaccinated. Now, I have on my phone, and many of your countries do have this, I have a variety of different apps. I'm just turning on this app. It's face recognized. And you might see here on this, I have here different apps that show that I'm vaccinated. I have different apps that show, and I highly recommend this. If you're traveling, I have an app that shows, it's a face recognized, so I have to, oops, cancel, okay, passes. It shows what, right now it does, I don't have negative COVID passes on there, but it will show what negative passes. Right now I'm positive, so this show negative passes, but it would give a Q code that I have a negative test. So one, you have to decide for your workplace, depending on how many people you have, and readily accessible vaccination, which in most countries is available at no charge by way of public health and the government. You have to decide not whether your employees must be vaccinated or not. That often is a personal choice. You must determine whether they can be vaccinated or not in order to show up to work. A lot of my clients are perplexed by that because they're frightened that if they mandated vaccination, some of their employees would quit. And in cases where you are reliant on employees who are not paid a high wage and have lots of opportunity to go from employment to employment, that's been a dilemma. So I want to give an example, the nursing home business. The nursing home business around the world is dependent upon people who are paid above minimum wage, but not a lot of money. And they come from a variety of different backgrounds. They're suspicious about vaccination. If you mandated vaccination, you wouldn't have the staff to take care of the senior citizens in the residence. That's a complexity. So vaccination has to be thought through in terms of what you'd like to do, what you have to do, and what you need to do in order to take care of people. And I would lean more toward vaccination, to be honest with you, for the long haul than trying to get around it. I would work toward creating a safe and healthy workplace, both for the people who come in to frequent your businesses or people in the business. But you need to sit down both with your human resource people, your chief financial officer, your staff, and ask them. Survey staff. Often you're making your own opinions and you don't realize that staff actually are mostly vaccinated or willing to get vaccinated. And you're frightened about an issue that we saw, let's say in the senior care facility business. It actually was less than 5% of staff who were frightened about vaccination, though owners thought it was probably 50%. They were wrong. Find out, don't assume. That's the trust factor again. Next, corporate policies. I want to speak about this because someone can test as I tested negative in the morning and tested positive in the evening. You can only do so much. You can really only do so much. And I think you have to, that's the part where I said you only know what you know, or I don't know. You only know what you know when you know it. You have to start your policies in a realistic way. We seek to create a safe and healthy workplace. And yet we're dealing with a virus that on one part of the day, you might test negative, and then You might find that you've become positive all within the same day. Keep in mind what I said. I tested negative in the morning. I tested positive in the afternoon. Translation, I could have showed up to the workplace in the morning, infected people because I was carrying a viral load throughout my day, and then tested positive and said, oopsie, I think I should run home. That's a reality. That's the reality. So you have to state that in the policy, that by coming in and seeking to create a safe and effective workplace, it doesn't mean that the policy is a protective shield. It's a guide. And you need to state that as a caveat so that people understand that they too are taking a degree of risk in hand, and you're trying to minimize risk. The other aspect is in terms of, you can say we'll be 50% capacity, wear a mask. I was wearing a mask my whole time, really took off my mask, unless I was alone outside walking. I still got COVID. Go figure. How? Don't know. I've spoken to everybody I was in touch with. Everybody else is negative. So there you go. You can set a policy, but understand the policy is not a, is by no means a protective shield. And that if you have people who are ill, you lose productivity. In my case, unfortunately, I was vaccinated. I'm relatively strong. I've not lost a moment of work. But for some people, I do know younger people, much younger people, they've been quite ill and vaccinated. So you have to consider whether you want to have a hybrid policy, a remote policy, or in fact, take the chance. Take the chance. And that's the part with policy. Don't look to another company and say, what's so-and-so doing? Use your culture, use the science, use the public health policy certainly as guides. But my advice is, look at the nature of your business. Look at the nature of your business. Speak to people authentically. And this is something that often corporations don't think enough about. Think about the person who is most fearful and seek to communicate in a way that you're addressing what they might be feeling and thinking. There's a tendency for us to sort of say, well, tough it through. But you can actually create a disconnect with employees. And that's going to be very, very, very dangerous. Part of the reason companies have opened up is the fourth point that Ciro asked me to address, which is the bigger health impact, mental health. There's no doubt about it. We are seeing much more prevalence of mental health issues, despair, depression, suicidality amongst people we never imagined would be at risk. Particularly when I look around, when I speak to people around the world, employees, adult teenagers. There's been much more prevalence of suicidality. Doesn't mean they're going to act on this. It just means that they're feeling such despair that they talk about doing harm to themselves. Take that seriously, by the way. They talk about doing harm to themselves. Take that seriously. As employers, we often don't know what stressors employees face at home. And I do think for those of you who have slightly larger communities, speak about that. If you have an HR department, ask your HR department to get resources about that. You won't be privy to that, but if you offer some form of either state government or employer health insurance, your health insurance companies will have resources. Get those resources, study them yourselves, and be prepared to address what employees' needs are. That's a very critical factor. So I can say that we're seeing a lot more mental health issues. And I actually will say personally, my wife is a child clinical psychologist, and she has said in the last 18 months have been the busiest time in her entire career. So it's an N of one again, but I've seen this amongst thousands of employees as well. Let me stop for a few moments and answer questions, and then I can always go back and provide you with more data and information.
Thank you, Gil. Very interesting views. I want to start by shedding light on the key word you mentioned, trust. You live in the U.S., and U.S. by far the country offering vaccines, different vaccines. There's no problems in offering and giving people the possibility of being vaccinated. On the other hand,
we're only the 59th nation in the world in terms of vaccination rates for COVID. Think about that. The nation that essentially manufactured the bulk of the vaccines available in the world today, whether it's the Pfizer or Moderna vaccine, the J&J vaccine was actually a combination of I think, if I'm not mistaken, perhaps Sweden and J&J. And then Germany was very much involved in the Pfizer vaccination, obviously the UK with the AstraZeneca vaccination. However, when we look at the world vaccination rates, the US rates very poorly.
Yeah, that's my question. There's a lack of trust.
Correct.
Of the relevance of vaccination, and how to explain that, how to deal with that. Joe Biden last week decided that he will make vaccination almost mandatory in the US in order to fight back the Delta variant. So how to deal with that? There's a psychological issue to be confronted. How to deal with that?
Yeah,
to convince people that
I find that when we look at generations, we look at smallpox or polio, and people remember the images. If you don't remember, go online. The images of people with polio and iron lungs. The famous images, of course, of a room with young people in an iron lung that's breathing for them, and you see nurses caring for hundreds of people in a room who have been struck by polio. Parents in the 50s, 40s and 50s lived in terror that their child would get polio. And then, of course, with COVID, we have seen some images of people on ventilation, but we are spared the images, for the most part, of people on ventilation. TV has become very genteel. The challenge is, once upon a time, we saw infectious disease in home. You know, the images of the Dark Ages and the Black Plagues. When you don't see what's going on, it seems very remote. And so we're dealing with a few things. One, information at the very beginning that evolved, and people are saying they don't know what they're talking about. And so rather than saying science evolves, they're saying they lied to us. Right? Fauci said masks, no masks, then he said masks, and he said you don't need masks, then you do need masks, then this one said social distance, but I saw the governor of New Jersey sitting, dining in a restaurant with his family, no masks. So one, everybody who's participating in your webinar today, and all of you are leaders, we need to realize we set an example in our behavior. So I tell people, as soon as I came home, I did not hug my wife, or I maintained social distance. I waited for 3 days. I tested and I came out positive. I've been in extreme isolation as a result. So I try to live the life as a role model. We no longer see scientists as role models. That's one. Two, scientists made a very big mistake. Scientists like to speak science, where the consumer, the public, doesn't really want to know about science. They want leadership and direction. President Biden is very effective because he actually tries to speak to the people, but he's now speaking to the people after 18 months of their feeling misinformation and uncertain. So now he has to be the stern parent. I'm mandatory. You can't go out tonight, right? You're grounded. So you have to be vaccinated. But you know, it's like a teenage child, this population is trying to figure out how to get around it already. So that becomes a challenge. So We have to understand that as communicators, we have to go back to the basis that Edward Bernays, one of the fathers of or ancestors of modern communications. It's not just what we want to say, it's how it's going to be received. Exactly. Right. And that's why I would say, Ciro, 20 years, I want to go back to you for a second. 20 years in business as a lead communications firm in a market is an achievement. And it speaks to your expertise. The role of an agency like yours, clients know what they want to say. That's inside out. Good agency like you helps match that with the outside in. I, the client, want to say this. As the agency, you say, but your employees or your customers, they need to hear this. You have to match it. And so I don't think our government or our scientists did that. They didn't do it well. And that created mistrust. And the mistrust is what we're left with right now. And we're not in a situation where we can reboot. We can restart the trust narrative around COVID. And when you can't restart the trust narrative around COVID, that's when you have the President Biden response, which is mandatory, because I can't convince you any longer. Now I must potentially impose a rule upon you, and then you get pushback. But like anything, you've got to decide what's in public good. You said something, Ciro, that I think was very important, which is the Delta. You mentioned the Delta variant, not COVID. We talked COVID's general. The Delta variant is a unique within the COVID situation. So the Delta variant is not like original COVID. It is easier to catch, and it is more potent than original COVID. The reason I would encourage all of you to get your staffs vaccinated and be vaccinated, set a role model, and urge people to get vaccinated is, in fact, the reason we're seeing this $5 billion in 3 months of unvaccinated people is we don't have enough role models. Each of you are a role model. It's expensive. It is a bad flu-like symptoms. I do have a pulse ox here. I have been taking my pulse ox. At one point, my pulse ox did dip low, even with vaccination. I'm health trained, I'm medically trained, so I can watch it. But I don't think we have the trust of the public any longer on this issue, because we have too many voices, way too many voices. And because of that, no one knows who to listen. By the way, Ciro, from a crisis communication standpoint, there's a lot to learn here. What do we tell our clients? When there's a crisis, have sort of appoint a spokesperson whose responsibility is to work with a team of assembling all the known facts and conveying it. What happens when you have many voices in a corporation speaking about the crisis? Everybody's trying to get their little piece of the action, their story. Who do you believe? What do we have with COVID? We have a public health crisis, scores of people who want to pontificate, not knowing who we want to believe, each one of us identifying with a spokesperson who we feel fits our voice and image. And as a result of that, what happens? Chaos. So there's a lot to learn, to be studied in crisis communications beyond COVID, most certainly. But I would say absolutely right now, as role models, if you've not told your employees that you're vaccinated, please do. If you've not made vaccination easy for your employees and you need to help them, please do. If you're not recommending testing, please do. As I said, I'm vaccinated fully. I still got COVID. I'm testing frequently. If I had not been testing frequently, my wife would have caught it. She was going to visit her 96-year-old and 90-year-old parents. Heaven forbid they would have caught it. What's the lesson here of the N1? Vaccination and testing, masking, washing hands, follow the basic guidelines.
I have two questions here. One is, I insist in the psychological issue. You know well that Bill Gates in 2010, he told that the world should learn from the Ebola issue in Africa, that we were lucky at that time that the medicine or the doctors, the specialists, had succeeded in controlling the epidemic at that time. So, and he wrote many articles about that. He recorded videos by saying, we need to learn from Ebola. We were lucky, but we need to be prepared for the next epidemics, the next eventual pandemic. So looking back now, it seems that we haven't learned exactly. We didn't, it seems, it's my personal view, it seems that people, authorities and politicians, they did not pay enough attention on that specific event and not work hard in order to prevent other issues. Am I right or wrong? Did we learn something from that event or not?
Our scientists have, our public health officials have. I want to compliment members of the World Health Organization and other global public health entities. They, Cyril, really have learned, and they work together magnificently. I have a colleague in our organization, Richard Hasfeld, who really works closely with those organizations. I encourage you and others to tap into his knowledge whenever you want. But our public health officials and our infectious disease officials have learned. The challenge is our politicians are appealing to constituents that may or may not care. And you're touching on something that Bill Gates was really dealing with on a higher issue, which was our ability to look at challenges we face collectively as a global community. For some reason, COVID has not brought out the best in us. In many cases, I'm saddened to say it's brought out sometimes the worst in us. The virus that affects us in New York affects us in Germany, affects us in Sao Paulo, affects us in Senegal, affects us in Singapore. And for some reason, nations feel like that's not going to be my problem. Ebola is going to be Western Africa's problem until it lands in New York City on a plane, and then it's New York City's problem. I think that there's common issues that we face, infectious disease being one of them. Another issue that I know you and I have touched on, I'm very concerned about, is climate change and eco-health. We're going to see more infectious disease around the world, not just because of viral shifts, but you have to sort of say, why does that happen? Why do birds migrate in different patterns? Why do people get sick in different ways? Why do we see infectious disease post a hurricane or an earthquake? And so these things are not in isolation to each other. I don't want to frighten people. I'm an optimist. I truly am. But our globe's temperature is rising 1.5 degrees Celsius steadily. And that's going to create a situation which we're seeing now. Don't know if you're facing this in Brazil. I've seen it in other parts of the world. We've seen flooding in Germany. 2 blocks from my own home, we're not near any tributaries, rivers, bodies of water. There was flooding. Houses were evacuated 2 blocks from my home in outside of New York City. That's never happened before. We've seen raging fires in the Pacific Northwest of the United States. What is happening to our world is slight climate shifts. When you see those climate shifts, you actually will see shifts in disease pattern. And so we tend to think of climate as separate from health. Now, the health of the planet, our personal health, are intertwined. So, if anything, if you haven't invited the question, but I'll make the statement. I think along with COVID, this is a good time for everybody to sort of say, you know what, I've got your attention on COVID. Let's talk not only about preventing COVID, let's talk about preventing disease. Let's talk about your health. Let's talk about your weight. Let's talk about your diet. Let's talk about your mental health. Oh, let's talk about how much paper we use. Let's talk about commuting. Commuting costs, gas, fossil fuels. I think it's all on the table right now. And I think that we're going to find as corporate leaders that our governments actually are going to rely more on us as corporations to step forward and actually make changes. Because I think we're starting to feel maybe some of our governments are paralyzed to make the changes themselves.
I have two questions here, one in the chat, other that came to me directly, and they are in a way or another related. So I will try to summarize those two questions. One is related to the potential tendency of human beings or employees to become more individualistic and trying to avoid teamworks and working more from home. And the other questions that I put together here is, what is the role of the HR departments, HR professionals, how to re-motivate people to work together to feel comfortable in this, let's say, new normal in the workplace.
So I saw one question pop up, which is like business development, like now what do we do, like to grow our business? And then the HR question, which is a really good question. Traditionally, many HR departments, let me take the second one first. Traditionally, HR departments were really designed to administer the policies of the corporation, vacation policy, health benefits, performance records, pay raises. They worked with accounting, and that was the HR role. The challenge of that has been that suddenly HR is being asked to develop policies. And depending on the size of the corporation, the HR department sometimes is equipped and sometimes it's under-equipped. But that's why we have to work together as senior teams. So I am working with companies where the HR department really is, they know public policy, they know communications, they play a very strong role in internal communications of the company. Where companies don't have strong HR departments that can communicate with employees other than here's a policy, where they don't have that sort of skill, they actually have to rely on their communication partners. I'm quite serious. It's not just a plug for you, it's a plug for the discipline zero. But often you have to match what you want to say, as I said earlier, to what employees are going to hear. They need to hear, and how they're going to hear it. And often an HR department is writing communication in terms of, this is what I want to tell you. That doesn't mean it's going to have an impact or change thinking. So HR should be playing a role. HR actually, like every individual, they're made up of people. People sometimes are uncomfortable saying, I don't know, what I said earlier, which is, I don't really know how to communicate with these people in a way that's going to convince them or unite with them. And when you get to that point, honestly, the strongest thing you can say is, let me bring in a partner who can help me do that effectively. That's where we get into trouble, when we think we're going to be able to do it by ourselves. So one, I would say HR has a very strong role to play here, but corporate leaders, your HR department, determine their strengths. If they can do it, great. If they can't, get a partner to help them do it. That's one. In terms of the business development role or building community, culture rules. Businesses thrive on culture, and you really need to look at the fact that we're going to stay in a hybrid environment for a very long time. This is not going to end after COVID. Employees are not going to say, I want to come in 5 days a week into the office and commute, whether it's an hour or 10 minutes. They're not going to do that anymore. So corporate leaders need to take a look, not just at productivity, but community and culture. You need to have a community. So I just want to touch on that. Sit down and start to think about what your corporate culture is, and then use that to build community. I hope I addressed that. I want to be conscious of our time here.
One maybe the last question, but it's inevitable. It's related to a question related to technology. How new technologies will influence new treatments, new ways to address health issues in the near future?
Great question. As a matter of fact, I wrote a column for Health Tech World. You can follow them online, Health Tech World. They're on Twitter, or follow me, Gil_Bashe. I write a piece on new technologies in health, and I'm always happy to share ideas on this. Look, the concept of whether it's wearables or a smartphone or just our laptops, we actually have the capacity now to deliver care remotely around the world, and actually develop new treatments using a process called decentralized clinical trials. There's an organization I recommend people follow called DTRA.org, Decentralized Clinical Trial Research Alliance.org. It's a consortium of about 130 entities around the world, large companies, small companies, regulatory bodies that are working together to use remote technologies to include people in clinical trial development, drug development. These days, the ability to see a doctor should be readily accessible to people at all economic levels, whether you have a smartphone or you have a flip phone. The challenge is not technology, Ciro. The culture is the killer. I talked about building culture for corporations a second ago. Medicine is a culture, and it's a culture based on economics. The economics determine how doctors and the system get paid, and the system is not flexible in changing its economic model. So the problem is not the evolution of technologies, whether it be the use of artificial intelligence or virtual reality or wearables, or, as I said, smartphones or laptop use or kiosks, all of these sensors. We have great technology. I have many of it here on my desk that people send me to take a look at and evaluate. That's not the problem. The system is the problem. The system likes the system. The system is the customer, not the patient. So the big answer to your question is, you know who's missing from the equation when we're talking about healthcare? The patient. I always hear corporations saying, we should invite patients to the table. Let's hear from a patient. And you know what my answer is? Invite them to the table. It is their table. You wouldn't exist if they didn't have needs. It starts with them. It continues with them. It concludes with their well-being. The problem isn't about the amount of technology we have, Ciro, or our ability to innovate. It's that our culture is not willing to adapt fast enough to our imagination.
For me, there are 5 key definitions or key words that will be my takeaway today. One is trust, the other one, culture. Third, leadership. Fourth, evolutionary model. And 5, patience. So, and we know that you have a very busy agenda. I want to thank you again, Gil, for being so kind and accepting our invitation to share your views, your insights, your knowledge about the issue health. And we didn't know that you had COVID,
I didn't want to fight you. I didn't want to fight you. Say, oh my goodness, after all this, he's not going to show up. No, but I do want to say there's a sixth takeaway. There's a sixth takeaway. Congratulations, Ciro, to you and your community. 20 years of exceptional service and communications. Your global leadership, representing some 100 agencies around the world through PROI, has been exceptional. I not only want to wish you great success on the next 20 years, I want to wish you great success on the behalf of the communications industry on your second year serving as chair of this global organization. It is a privilege to be with you today. We salute you, we thank you, and I want to thank you and your colleagues and your clients for allowing me to join you today.
Okay, thank you, Gil. Hope to see you again in the near future in future conversations. And
Absolutely.
Thank you for all the audience.
Thank you so much, everybody. Take care.
You too. Thank you. Bye.
Encerrou, Guilherme.
Fechou, Guilherme?